Smily. I am from King Saud Abdulaziz University in Saudi Arabia. Thank you for this wonderful opportunity from the Venus International Foundation. Especially I thanks Chairman and also the organizing committee. I like to present the effectiveness of occupational therapy intervention among the children with learning disability. This is the retrospective study. Can you go to the next slide, please? So let's go to the introduction. You all know about learning disability, right? Okay. So what is mean by the learning disability? It's basically the children who have affected with the learning disability by the cognitive problems that might be affecting in the neurological disorder. It may be a multiple causes, maybe by genetic or metabolic disorder and any brain structural problems. That's the main reasons. And also the research says that there are multiple factors that might be affecting the children. And let's see, there is a lot of, the prevalence rate in the Saudi Arabia, it's around 2.9%. So we have a question, there are so many interventions are going for in the rehabilitation setting, especially in the OT field. What is the specific occupational therapy intervention can be used for this particular children? So that we have an aim to identify the best effective occupational therapy intervention among the children with occupational therapy. And also the specific objective is to find out OT intervention in learning disability for the past 5 years from the 2019 to 2024 in best care system. What do you mean by best care system means? In Saudi, they used to put all the data in the best care system. So we collected the data from the best care system so that we know what are the interventions they are using, and then we can take the research according to that. And next objective is to find the most effective OT intervention, especially the pre-treatment and post-treatment used in the children with learning disability. Next slide, please. Let's go to the methodology. The study design, we use that, it's a retrospective study that is called the single cohort without control. Before we start the study, we got an IRBL approval in the university, and then we go for the data collection method from the best care system. We taken from the medical record numbers, and then we taken the sample, around 250 samples we have taken. But according to our inclusion-exclusion criteria, we just only taken 24 participants. The inclusion criteria, we have chosen both males and the females, and with the age range of 5 to 18, but we got the patients only the age range of 5 to 14 is the mean range we taken as a 9 years old. The patient who receives OT treatment, especially the children who have basically the 3 problems that is called dyslexia, dyscalculia and dysgraphia. Dyscalculia means there is a difficulty in the calculation problem. Dysgraphia is a difficulty in writing problem, and dyslexia is a difficulty in the reading problems. Next slide, please. Basically, the finding says that we use the intervention. There are so many interventions we have used it, especially in the sensory, attention, memory, and handwriting skills. This is from the subjective methods. From the subjective method, it says the sensory is not that much improved, but attention, memory, and handwriting skills, that shows that there is a statistical significant differences. Whereas when you're going for the outcome measures, we use the FIM, that is called the functional independent measures, that basically to measure about the dressings, bathing, grooming, especially the daily activity skills. And MMT we have used, that is for checking the hand muscles. So it both says that there is a statistical significant differences in the outcome measures of muscle strength as well as in the daily living skills. This is the significant difference is coming from that. What is the best approaches? We found there are so many approaches OTs are using, especially there are 7 approaches they are using it. First one is they use the biomechanical approach, and next one is sensory integration approach. Third, neurodevelopmental treatment. Fourth, and behavior modification approach. And fifth, they are using the cognitive behavioral therapy. And sixth, they are using the rehabilitation method. And seventh, they are using the sensory motor approach. And finally, they were using about the visual perception approach. From this, all these things, it says that cognitive behavioral approach is most of the children, they are beneficially, they are in the handwriting skills, they are improving. Along with that, biomechanical approach and also behavioral modification approach is also be the best one. Next slide, please. From this one conclusion, I want to say that the discussion part, in learning disability, most of the children, they are not using the only one approach, it may not be a beneficial. So multi approaches is the beneficial, especially you can see the attention is greatly 75%, handwriting is 52%, memory 48%, and outcome measure, when you see that functional independent measure is 20 and MMT is 12.76 and sensory is only at 10%. That means the multi approaches is more effectively we can use for the children, especially for this learning disability children. While we concluding this one, the study was contributed to the outstanding of occupational therapy intervention for the children with learning disability with the various approaches and the specific activity therapies chosen to apply in this practice. From the therapist point of view, the multi approaches is the best approaches we can use for the learning disability children, and future assess also can be conducted based on this multiple approaches. But currently we can use the cognitive behavioral approach and also behavior modification approach, and biomechanical approach is effective, can be used for the learning disability children. Next slide. This is my references. Thank you so much for giving this opportunity.